Hello, welcome to this video. So this video will tell you about the case notes regarding patient Mrs. Jasmine Thompson's discharge. So this is a discharge letter in which patient is going to be discharged home today with assistance from in-home nursing service. You are a registered nurse who's preparing Mrs. Jasmine Thompson's discharge. So let's read the task first. What is the purpose of the letter and to whom we are writing the letter? Okay. So using the information given in the case notes, write a letter of referral to Miss Roberts, a home nurse, informing her about the patient's situation and requesting appropriate care. Okay. You need to address the letter to Miss Nita Roberts, in-home nursing service, 79 Beachside Street, Bayview. Great. So we are writing the referral letter. We are referring the patient to a home nurse whose name is Nita Roberts for the current situation, for the appropriate care of the patient following her discharge. Very clear now? Let's read the case notes now. The case note says patient's age is 75 and social background, lives in a single-story house with large garden, utilizes cleaning services once a month, widow. Okay, she's a widow. One daughter is there. She lives in Bayview. One son who's married with 2 children, lives in Stillwater. Daughter will stay with mother for 1 month post-surgery. Medical history says she had right humerus fracture in 1997, osteoarthritis in right shoulder which has not responded to conservative treatment, chronic right shoulder pain which leads to decreased movement and ability to carry out activities of daily living. Okay, so means due to this pain she has some problem with the movement and also about the daily living activities. Current medications are Voltaren 50 mg daily and Pendinfort is there. Admission diagnosis is right shoulder osteoarthritis. So, okay, why she is being admitted? The admission diagnosis is right shoulder osteoarthritis. Great. So, medical treatment record says on 11th of July 2017, she had her TSR, that is total shoulder replacement for the right shoulder. Medical progress is post-operatively X-rays confirmed position of TSR and also exercise regime, but there was a complaint with physiotherapy and bloods were within normal limits and pain management were done with analgesia, cold compression for the right shoulder, and right shoulder wound was clean and dry and drain site was also clean and dry. On 15th of July, there was a plan for discharge home with daughter today. So today is 15th of July. She has a plan to be discharged home with daughter and they also need a home nurse to assist at home. And what are the nursing managements? Observations, that is TPR, BP, all were in normal range, means pulse and her temperature, blood pressure were all in normal range. All the vital signs were normal. Neurovascular observations, color, warmth, movement, sensation, everything was fine. Oral analgesia was done. Wound care and observations, cold compression, shoulder brace 4 hours per day, and she was assisted in daily living activities as required. Then there is something about physiotherapy management also. Exercises as per TCR protocol, neck range of movement exercises, elbow and hand exercises, pendular shoulder exercises. Cryo cuff, cold compression, that is 4 hours per day. Discharge education, follow-up physiotherapy outpatients or appointments, and referral to community hydrotherapy. Discharge plan, patient discharge education post TCR, right arm sling for 4 weeks, strictly no lifting for 4 weeks, physiotherapy outpatients, that is twice per week, 2 outpatient sessions are required per week, plus hydrotherapy 1 per week. 10 days post-operatively, staples removal, follow-up appointment, orthopedic joint replacement, outpatient department, and orthopedic joint replacement nurse specialist contactable by calling hospital Monday to Friday for any concerns. Referral to in-home nursing service, assist with showering and administration of Clexin subcutaneous for 4 days as DVT, deep vein thrombosis prophylaxis. So now here you are referring the patient for home care. So obviously we need to tell what happened to the patient and what is her current condition. We need to focus on that and what the patient requires following the discharge. These are the areas what we need to follow. Let's now have a plan how to plan a letter, how we'll write the letter, and I'll just show you the sample letter also. So you can start like this. I would be most grateful if you could manage home care for Mrs. Thompson, who's being discharged today after a total right shoulder replacement. Following admission to the hospital for right shoulder osteoarthritis, we have mentioned why the patient was admitted and why we are writing the letter. Then her daughter will stay with her for 1 month in her single-story house once she has been discharged. So we are writing the complaint as well as the purpose of the letter now. Now we need to write what is her current condition. What is her condition now? Mrs. Thompson's post-operative phase were largely uneventful. She has been complained with her physiotherapy exercise regime and her post-operative blood remain in normal limits. Post-operative pain was managed with analgesia and cold compress for 4 hours each day. Great. Then we need to write on discharge, patient was educated in post-operative care that she'll wear a right arm sling for weeks, 4 weeks, and require physiotherapy also, and then hydrotherapy, and then she is not to do any lifting for 4 weeks. Then we need to write what the patient requires. She requires assistance with showering, administration of a prescription, and injection is there, and we need to write about her staples which are scheduled to be removed within with a follow-up appointment in orthopedic joint replacement outpatient department. This is very important. Then, in case any issues arise, the nurse specialist can be contacted by calling the hospital during the week. Monday to Friday is similar. You can write the word week also. Do not hesitate to contact me if you require additional assistance, sincerely. So this is how we are writing the letter. Actually, in this letter, a lot of things were given, but we are writing to a home nurse. And after her discharge, she's fully fine now, but she has some problem with like pain. She's taking some medication. She needs some help and assistance in physiotherapy also. So here, do not get confused like what to write and what not to write. The main thing is you need to write why we are writing the letter, what is the complaint, and what patient condition is after the operation. Only we need to write which is the main thing there. Then what the patient requires after getting discharged, and also what kind of assistance is required for the patient by the nurse, and then about her sutures. These are the things you need to mention. I hope I have tried to clear all your doubts regarding this letter. Just practice this letter on your own, write down and send it to me. We'll correct it. And just practice these types of letters and do not get confused about what to write and what not to write. Only this is the problem students make when they go for exam. So stay tuned for the next video and keep on practicing. Thank you for watching this video. You can subscribe our channel. If you want online or offline classes, you can anytime contact us on this number and enroll with us. Thank you. Have a nice day.